contracted, when atrium is contracted, the pressure increases. C, due to the ventricular contractions. And V, when the valves are closed. The ventricles are in isovolumetric contraction, the blood is gathered into the atria and the pressure will increase. This is called D. During isovolumetric relaxation, when the valves are closed, no volume changes will be increased in the ventricles. When the valves are closed, blood is coming into the atria. So the pressure increase during isovolumetric relaxation. During isovolumetric relaxation, the blood is gathered into the atria via great veins. In the left atria, we have 4 pulmonary veins. In the right atria, superior vena cava, inferior vena cava. Blood is coming into the atria and the pressure. We have also descent. Pressure drop. After completing atrial contraction, when the atrioventricular valve are open, first the pressure increases, then pressure drops. This drop is due to the pouring of the blood. Sorry. So we have 2 descent, Y and X. Forget about the reason. Because this is not mentioned in the right computer. We have 2 descent, X and Y, forget about the mechanism. So this is the jugular pressure curve, aortic pressure curve. Now cardiac sound. How many sounds do we have? 4. 2 can be heard. 2 cannot be heard.
Why do we call this atrial pressure curve?
Which one?
Jugular pressure curve.
Because it can be measured via a catheter that is put into the atria or in the jugular vein. Both catheters. We have. Take a look at the picture. This is phonocardiogram. Using this apparatus, you can record different cardiac sounds. Normally, we have 2 sounds. During ventricular systole, when the pressure inside the ventricles increases, pressure increase causes the atrioventricular valve to be closed. There is no physical touch between the causes. So, closure doesn't make any sound, but vibration of blood and the tissue around it causes the sound. This causes the first heart sound, or a swan. Closure of atrioventricular valve vibrates the blood and the tissue around it, the ventricular walls. This causes the first heart sound. The first heart sound is long with low pitch. Long and low pitch. The second, during the diastole, backward of blood, backflow of blood, causes the aortic valve and pulmonic valve to be closed. This closure vibrates the blood and the tissue around it and makes the second heart sound. The second heart sound. Sorry, the first heart sound is long and short pitch. The second is short and high pitch. The first is long, short pitch. The first. The second is short and high pitch. Due to the closure of the aortic and pulmonary vein. During inspiration, see what is happening. During inspiration, especially deep inspiration, we have a negative pressure inside the thorax. When we have a negative pressure, there is a pumping activity in the thorax. So more blood is coming to the right part of the heart. During deep inspiration, when more blood is coming into the right part, aortic valve is closed earlier than the pulmonary valve. So there is a normal split between closure of the aortic valve and closure of the pulmonary valve. This is called normal split. What is usually how when we can usually see it during deep inspiration. This is called normal split. The third heart sound. The third heart sound this is part of the second one. You see it.